Well, cardiac CT is very similar to a normal CT that we all know of, but the difference is that we are able to actually visualize the coronary arteries with a high degree of detail. In the past, we couldn't do that just because the heart moves and it obscures and causes a lot of motion artifact. But now with the latest technology, the patient will be attached to ECG electrodes, which sends a signal to the scanner and the computer and allows us to eliminate the motion artifact from the heart and produce very detailed images of the coronary arteries. Traditionally, this would involve a catheter into the femoral artery going all the way to the heart, injection of contrast, but now with the use of cardiac CT we can assess the coronary arteries. It's as simple as the same as having a CT scan. Well, during a cardiac CT examination, it's very similar to a standard CT. You'll be lying on the CT scanner, we'll be putting but the difference is we'll be putting some electrodes on the chest. This would allow a signal to go to the scanner and help us produce the images that we have. It's important that the heart rate is stable and steady, so we may give you a drug called a beta blocker. This is a drug that lowers the heart rate. We may give it to you a few days before the study, or we may give it to you during the study. It would just mean that we'd be able to get much better images with the heart rate stable. So this is a drug that you may need to have, or you may not if your heart rate is stable in the first place. The risk, as with any CT examination, we are giving radiation, but the risks are very small, and the potential benefits certainly outweigh any small risks that are there. We are always exposed to background radiation in the atmosphere. It is there, and I would say that a CT examination, one CT examination, depending on what dose is given, is probably similar to 6 months to 2 years of just normal background radiation. So the risks are small, but of course we must always keep the dose as low as possible, and a CT examination is only indicated if needed. After the examination, myself and also the radiologist will look at the images to make sure that we've got the quality that we like. If we feel that the quality is not as good, it may be because of a momentary rise in heart rate, it may be because of a bit of movement from the patient, we may do the study again. But this is quite rare. Most of the time when the examination is finished, the patient may have to stay in a while just for a couple of hours, just because if we have given beta blockers, we just want to check to make sure that the blood pressure and pulse is fine, and if that's all okay, the patient can go home. I will then look at the images in detail, I'll perform some reconstructions, and we will then provide a report that will go back to your doctor. This is an example of a cardiac CT examination, and you can see it's very similar to a standard CT, except we're able to visualize the coronary arteries with very good detail, something that we couldn't do in the past, and we've done that by able to eliminate the motion of the heart. And once we get these pictures, we can then produce what we call reconstructed pictures of the coronary arteries, and these are the kind of pictures that we can get. This is the left anterior descending artery. This is another picture of it. You can see very nicely we can reconstruct the coronary artery and look at it at very nice detail. This is another coronary artery. This is the circumflex artery that supplies the lateral wall of the heart. And again, we can see it in very nice detail. And this is the right coronary artery here. In addition, we can produce what we call volume rendered images, so we can actually see the heart as it is. And these are very useful pictures. They're particularly useful for the surgeon who may want this to aid in any surgical procedures that he is doing. But these are the kind of pictures that we can get. These are beautiful pictures of the coronary arteries, and we can do this non-invasively, very similar to having a CT scan. So we don't need to put in a catheter in the femoral artery. We can do this just as having a normal CT scan, and it is very quick. And these are just the pictures that we can get here. So if I show you, this is before, again, this is the right coronary artery, and this is a normal right coronary artery, but this is an example of a diseased coronary artery, and we can see all this, what we call soft plaque, that is in the coronary arteries. And we can see this very nicely, and again here there's a lot of soft plaque here occluding this part of the coronary artery, causing severe stenosis up here. So this is the kind of questions that we can get. We can also do a calcium score. A calcium score is a cardiac CT, but we don't give any contrast. It is exactly the same, but no contrast, and we can actually visualize the amount of hard plaque in the coronary artery. So this here is calcified hard plaque, and this is useful information because the amount of hard plaque can help the clinician manage and predict future cardiac events. So it has very good prognostic information. This is what we call a calcium score. But the limitations of a calcium score is that we may miss soft plaque, which a full cardiac CT can show. And these are just other examples. This is a patient whose coronary arteries are in the wrong place. And this is cardiac CT is very good at showing this. We can see here that the right coronary artery is actually originating from the left side when it should be originating from the right side. And this is important to know because this can actually cause chest pain, and in some individuals they can even lead to sudden cardiac death, so it's important to know this information. But this is the kind of information that we can get with cardiac CT. These are other examples. This is an aortic root abscess, and we can see here beautiful volume rendered 3D images of that as well. Patients who have had a bypass in the past, we may want to know if the bypass grafts are patent. Again, that would traditionally involve a catheter in the femoral arteries, but now we can assess this very well with CT. And these are pictures of a graft. These are all patent grafts, and we can show this very nicely with CT. These are all grafts going to the coronary arteries because this patient has had previous surgery. We can then show beautiful volume rendered images of the heart, and this is again very important for the surgeon to know. He may want to know lots of questions like where are the grafts, where they're going to, also what is the aorta looking like. And here we can show the aorta. This is a lot of calcification at different parts of the thoracic aorta, but these are the kind of images that we can get. And CT has probably revolutionized the way we manage heart disease, and it has improved patient journey because it's a non-invasive test.